because you might be able to transmit the virus to people who are not vaccinated yet, and you can see how this could potentially become a big problem. Hi guys, welcome back to my channel, Nadine Speaks. If you're a returning subscriber, welcome back. If you are new here, don't forget to hit that red subscribe button down below and hit that notification bell so that you get notified of my new videos. So in today's video, I'm super excited to bring you a vaccine Q&A. That's right, I'm going to be answering the most burning questions that you have at home regarding the vaccine, and hopefully you can get some clarity on your questions and what is misinformation and what is actual factual information. I'm going to be spilling all the tea on all the different data that they've gathered during the clinical trials so you can decide for yourself. That's right, you do still have the right to choose if you should get vaccinated or not, but let me tell you, the answer is yes. However, if you're in a vulnerable population, you might take longer to think about it and decide if the risks outweigh the benefits for you. I asked you on my Instagram story, if you're not following me, go ahead and follow me at Nadine_speaks. I'll link it down below. I asked in one of my stories what your burning questions are for the vaccines, and here I am letting you know the answer. So the first question, I got this so many times, is the vaccine safe? So in answering the question, I decided to compile all the data that we have currently regarding the vaccine. So there were a bunch of clinical trials, but the two vaccines that are currently approved are the Pfizer and Moderna vaccine. So I thought we would just look at the straight up facts of what those clinical trials have shown us so far in regards to data and why the FDA was able to approve these vaccines for emergency authorization. Let's first deep dive into the Pfizer vaccine. When we look at the data for the Pfizer vaccine, we see that 43,000 participants in total, 16 and older, participated in the vaccine. Now there were two different groups in the trial. There were those that received the vaccine and those that received the placebo, and it kind of was split down the middle. So 21,000 participants received the vaccine and 21,000 were in the placebo group. After 7 days of injection, so a week after they were injected with the vaccine, they saw 8 cases of COVID in those that had received the vaccine and 162 cases of COVID in the placebo group. So you can already see a dramatic difference between those who received the vaccine and who did not. Now, because there were still people that got COVID after they were vaccinated, this is where we see that 95% efficacy rate for the Pfizer vaccine. Now, Moderna is very similar. And when you look at a clinical trial, first of all, they outline their primary outcomes. So the primary outcomes in the Moderna clinical trial were a little bit different. They were looking at the symptoms of COVID, and they wanted to see that if people who got vaccinated, if they got a severe case of COVID or not. Theirs looked a little bit differently, but they still had a similar number of participants. They had 30,000 participants in the Moderna clinical trial. And there were also two groups. So there was the group that received the vaccine and then the placebo group, or otherwise known as the group that did not receive the vaccine. If you don't know what placebo means, I urge you to look at my first video I did in this series diving into the phases of clinical trials, where I explained different terms that they use when describing clinical trials. So I'll link that up above so you can click on that and then come right back here. In those that were vaccinated, in their group, they saw 0 cases of severe COVID. So there were 0 people that had COVID with serious symptoms, versus the 11 cases of severe COVID in the placebo group. So those that did not receive the vaccine, they saw that in that group there were 11 cases. Now, because there were cases but not severe in the vaccination group, they too had a 95% efficacy rate. Now, in both trials, there were 0 serious side effects. So in saying that, I will say that yes, the Pfizer and Moderna vaccine so far is safe. We have not looked at the long-term side effects yet, but as far as we know, currently, right now, it is safe. If the data in those clinical trials has not swayed you yet on vaccinated or not vaccinated, we can look also at the New England Journal. So there's this really good curve that you can see in individuals that got vaccinated versus not vaccinated, and you can see a dramatic difference. So I can strongly say with confidence that yes, it is safe, and yes, it is actually effective in preventing or lowering your severe symptoms for COVID-19. Now, this leads me to the second question I got, and actually I was thinking about this in the car the other day as well. So I was thinking to myself, well, let's say you got vaccinated, and let's say you actually got the virus yourself, because even if you're vaccinated, you can still get a virus. However, the vaccine does help with lowering the amount of symptoms and severity of your symptoms that you get when you get the virus. So if you get the virus and you're vaccinated, can you transmit the virus to other people, and do you still need to wear a mask? That's a very important question, because people will be getting vaccines and then they won't wear masks because they think they can't transmit the virus to people who have not gotten vaccinated. So the answer to this question, so let me first start with the preclinical data, and let me remind you, preclinical data is when they do studies on animals before they conduct the clinical trial on humans. So they did do preclinical studies in mice and non-human primates, where the ones who got vaccinated actually did not transmit the virus to others that did not get vaccinated yet. So now we have data in animals that shows us that if we get vaccinated, we might not be able to transmit the virus, which is a good thing. However, we have still not done the studies on humans, and they have not studied how it is transmitted yet. We are just, with the vaccine, all they studied were the symptoms of COVID so far. Still need more data to decide if it is transmissible after we receive the vaccine. So because we don't know the answer to this yet, you still need to wear a mask if you're vaccinated, because you might be able to transmit the virus to people who are not vaccinated yet, and you can see how this could potentially become a big problem. Another question I got on my Insta story was, if you get the vaccine, will weird things happen? Now, I don't know what you mean by weird. Like, do you think it's gonna mutate your body and you're gonna become superhuman? I don't think that's the case. But like I said in my clinical trial video, they're still assessing the long-term effects of COVID. And so it is good if you have gotten vaccinated to enter any of the symptoms or weird things that you're experiencing in the vaccine adverse event reporting system. It's VAERS. I will link it down below, but if you've gotten vaccinated, you can actually download this app and report anything you're experiencing that is weird to you. But as a scientist, yes, you are going to feel some kind of immune response, because that's the whole point of a vaccine, is it's activating your immune system against this foreign invader. Now, look at my video that I did previously to this and how exactly the vaccines work in producing that immunity. Another question that I got on my Insta story was, when can I get the vaccine? So right now they are rolling out the vaccine in different phases depending on the state you are in and what country you're in. In the United States, and specifically Texas, because that's where I am, they're giving it to frontline workers, and that's phase 1A. So phase 1A consists of a bunch of different people. There are tiers of people. First tier of people that are receiving the vaccine are paid and unpaid workers in hospital settings, working directly with people who are positive for COVID or at high risk for COVID. Then after that, you have long-term care staff working directly with vulnerable residents. Then you have the people who are first responders, like 911 emergency services, and then home healthcare workers, and then residents living in a long-term facility. And after those phases, the next phase after that, we're going to see the older population get vaccinated first, and then the immunocompromised, and then probably people like me who are working from home, and the rest of the world who is not vulnerable. The plan is still unclear how it will eventually be given to everyone, because we do have to go through those first couple phases first of the people who are most vulnerable or high risk to get COVID. After that, I'm guessing they will be supplying pharmacies so that everyone can receive the vaccine on their own time, like at CVS or Walmart or Walgreens. The next question I got on my Insta story was, should I get the vaccine if I'm pregnant or if I'm breastfeeding now? This is a really good question, because it's good to be aware of what you're doing to your body could affect your children. If you're pregnant, I would say check with your OBGYN, and they'll let you know they're the best person to decide for you, because they know you as a whole person and know all your comorbidities or whatever else you have going on. If you're breastfeeding, I would also check with your OBGYN, because it is good to be aware that your breast milk is directly going into your baby and might affect your baby. Now, there have been no actual studies involving pregnant women or those that are breastfeeding, but my educated guess is for those that are breastfeeding, it might actually be a good thing to get vaccinated, because when you're breastfeeding, your breast milk is actually filled with antibodies that you're producing, and it's a way of passively giving immunity to your children. The last question that I got, and I actually had a conversation with some people about this, is what if you're immunocompromised? Should you receive the vaccine? And this is really interesting, and I kind of touched on this on my last video, but let's think about immunocompromised people. Their immune systems aren't working properly. The vaccine kind of relies on your immune response acting appropriately, because it utilizes the immune response in order to build immunity against the virus. So when you're injected with any type of vaccine, your body is producing an immune response and hopefully producing antibodies so they can recognize the disease or infection in the future. If you're an immunocompromised person, something in your immune response is not working properly. So we can see how this vaccine might not be as effective if you're immunocompromised. It doesn't necessarily mean you shouldn't get the vaccine. It just means that if you receive the vaccine, it might not work for you to actually build immunity against COVID-19. So these are all the questions that I received on Instagram. If you are not yet following me, go ahead and follow me on Instagram at Nadine_speaks. You can ask me any other questions that you might have regarding the vaccines. And thank you so much for watching these videos and getting your questions in. I hope to do more Q&As in the future of any other topics that you have questions about. Don't forget to subscribe to my channel for more videos, and feel free to always send me video topics or anything you might find interesting and want to learn more about, because I love researching different topics and I love spreading the information out there. Let me know down below if you're pro-vaccine or anti-vaccine and what your thoughts are on the vaccine so far. Don't forget to hit that like button if you're liking these videos, and I'll see you in my next one. Bye guys!